We're here at the 2014 ASHP Summer Meetings in Las Vegas with Deb Sain and Connie Larson, the editors of the ASHP book, Medication Safety Officer's Handbook. So, Connie and Deb, why a handbook for medication safety officers?
I think what we saw is we talked to people who were involved in this position, about to start a position, or just interested in medication safety. We found that they were all asking the same kind of questions. How do I prioritize my work? Where do I start? What tools are available for me to use? And that inspired us to think about writing this book.
Yeah, I think there's some other really great resources, but this one was geared towards people that were actually, that's part of their job, to be involved in medication safety, whether that's a new position for them or someone that's involved in committee work. And I think the different chapters help them to organize their work and get a good feel for what's required of medication safety work.
Connie, you just mentioned other resources, and what can a buyer of this book expect to find here that they really can't get anyplace else?
Well, like I mentioned, if this is going to be your job, I think the different sections of the book, it starts right from a job description. As we learned when we were doing it, that can really vary, the different types of activities that a medication safety officer can have. So I think this kind of highlights those different activities, and then again how to approach your work. Has a lot of tools that can be used in looking at medication errors and trying to resolve things. So I think just overall it has things that are focused for that particular individual in their new position.
How'd you, your backgrounds for both of you, how did you first get involved in medication safety?
Well, for me, I was at the University of Illinois, and I'm actually still there. I actually worked as a student and then progressed, and then once I graduated, I had a lot of experience working in the different areas, and as I became now the responsible person for providing medications to my patients, I started to see all the different processes and different ways people could do things. And then when I moved to the pediatrics area, I really felt like the opportunities for errors were considerable. So I started asking my bosses to get involved in doing things differently, looking at ways to standardize processes so that we could all be on the same page, made it easier for people to do their work and do it safely. Protecting the patient and the practitioners, basically.
Deb, how about you?
My journey in medication safety started about 25 years ago. Like Connie, I was also a staff pharmacist, and I worked with the director of pharmacy at the time who was trying to address some deficiencies related to Joint Commission for adverse drug reactions, medication errors, med use evaluation, and he created a half-time position dedicated to those elements. And from there, I became involved with risk management, with nursing, and with others. I forged relationships and developed a passion for medication safety. From there, I developed the medication safety officer position at an academic medical center in New Hampshire, and then again at a community teaching hospital down in Virginia. So it's a passion, and it's been really a lifelong journey for me.
In the time that you've both have worked in medication safety, what are some of the biggest changes you've seen in terms of the field? How have things evolved?
I think the complexity of the medication management system has increased over the years. I think the technology has added another dimension to that. Study of human factors and research in the field has just exploded, especially since the Institute of Medicine report, the first IOM report, was published.
Connie?
Yeah, I agree. The technology, really, the complexity, as Deb mentioned, can't be overstated. The processes that have to be manipulated to suit the technology instead of an ideal process, vice versa, has really provided a lot of challenges for practitioners. It's great we have all this technology, but how you can apply it so that it's the human factors issues that is quite challenging, so that the frontline people can really do their job safely and effectively has really been.
Good. Connie and Deb, thanks for your time.
Thank you.